One tragedy happened that is very unfortunate for us actually. This was when we were going back to our apartment and boarded into the lift. I stay on second floor in my apartment. So when the lift started nicely, we boarded into the lift. My kid Anas Iqbal, he is 3 year old. He was also boarded, and he was playing well. And during the while going up into the lift, but the moment when we were about to reach, all of a sudden he came front to the gate and he hit his left leg to the channel gate grill actually, which is gate of the lift. So the moment he hit it, we didn't get a fraction of second to save him. Actually, it crushed immediately. But immediately we, took him to the Kim's hospital. I was not knowing how the treatment was in Kim's and all. This was the first time I visited to the Kim's. But the kind of injury he had, right? It was very difficult to manage to any hospital. So, but blindly we came to the Kim's hospital. And the moment we enter into the emergency, the kind of action taken place and the kind of follow up and doctor started consulting with the senior doctors and all right. So the response and the action which we received, it was really mind blowing. I can't explain. After that, doctor explained. They were very optimistic and they gave the moral support. And the best part is, I would like to thanks to the entire team of the Kim's Hospital who has taken care. There is a pediatric head, Dr. Nitin Chawla sir. He followed up and he immediately visited to the emergency room and he told to the junior doctor, emergency doctor, let hold them, let me come and see what is injury and all that. And then he came and immediately he first took care of his stability. He should be fine, then he will be thinking of to save the injury and all and what we can do for the injury. So then after he rolled out the plan, he suggested and nominated the best doctor. So in his treatment, actually three doctors, the role of three doctors is very key role. Mr. Nitin Chawla is the first one, and then Dr. Bhavani Prasad, the plastic surgeon, because of his wounds were completely crushed and he got some fracture also in his toes. So or Dr. Roshan, he lined up Dr. Roshan, Dr. Bhavani Prasad, and then he himself actually. And it happened around 10:30 p.m. night on Sunday, 3rd of December. And after that we immediately reach and everything is taken place. And then and there, Dr. Nitin sir has decided to have a treatment, whatever the treatment we can do. Otherwise, nobody can, do anything if he will go somewhere else. So he forced to hold and he convinced, he motivated to his doctors and the team, and they were ready to do the surgery and all. And the surgery happened, and that took around 2 hours actually. After that, in surgery, during the surgery also, all were going smooth. There were, major complication actually, and the blood circulation was the major part. It was not reaching to all the toe, which was not normal, not even normal, very poor actually. Mr. Bhavani Prasad, doctor and plastic surgeon, and Dr. Nitin and Dr. Roshan all decided to let us wait and watch and have the surgery properly. And surgery is done, and we almost admitted here 10 to 12 days. And we were properly supervision and guidance of all three doctors. Every alternate day the dressing was used to happening, and plastic surgeon used to see that how the wound is going to heal, how the things are there, is there any kind of infection or any complexity. Dr. Nitin sir also visiting thrice a day actually, and he was just each and everything he was trying to take care of each every perspective. His health should be good, his stability should be fine, his his body strength should be intact, and it should not be deteriorating. So all, these kind of experience which I received, they do the treatment kind of something, they have their own thing. The first thing I would like to say for doctors, the entire team is, especially Dr. Nitin sir and Dr. Bhavani sir and Dr. Roshan, they were very optimistic actually. So always they were motivating us to be positive, forget about whatever happened, past is past. Now we have to, we as a team have to work on him to make this happen and cure as quick as possible. So from all the perspective, we as a guardian also focused a lot, and whatever the suggestion, whatever the guidelines, whatever the treatment Dr. Nitin sir has suggested, we followed blindly. We were not knowing anything. We just thought they are the guardian. We don't know anything about that, and if they are suggesting something, let's do that. And we were blindly following. It was a great experience. I would like to say, apart from doctors, nobody was having a hope his toe will be able to, he will be able to work and his toe we can be able to save. But this is drastic, treatment, and of course, Dr. Nitin sir was telling that we are doing our best, but always, upar wala hai. So we have to have the positive aspiration, and we have to always think positive and be optimistic, and whatever doctor is doing, let them do that, and the results will be coming out with the by the grace of God and with all our efforts. So in that way we have to be very optimistic. So that is how the result came, and now it is around 45 days, and all the POP and everything got removed, K wires and everything got removed, and the wounds is also healing nicely. And after we came here, visited here today to see that how he will be able to have the weight bearing and all. But now we are able to save all the fingers. When we are seeing the injury, we are not realizing that, hey, this is the foot which was injured like that, and this again came to a normal shape. And the one last thing I would like to say and then close my conversation here is, when we stayed here and I was worrying about how to feed the, all those medicine and all, Dr. Nitin sir told that this is my agenda. It's not like I have to do the treatment. This is my agenda to save his limb at any cost, and for that whatever I have to do, I can do. If you will call me at mid of night, I will be immediately visiting, and I will be coming back and seeing if any complexity. So I don't care about if it is a midnight or if it is a morning or whatever the time it is. So whatever I can do that, and my agenda is I have to save by any cost. Baki, rest of the thing is in hand of the God. But in terms of putting the effort, either me or if it is required, Dr. Roshan or Dr. Nitin sir and Dr. Bhavani sir or any other doctors also, we can arrange. So those moral support and those kind of motivation and all, it helped us a lot actually. And we as a parent only here for initial 2-3 days, then there was no moral support. All things we got from here with the doctor only. So again, I would like to thank. It was one of the unique experience which I can see so far I have seen. So thank you so much.